Mtu kama mentamada, educator, adherence counselor, wameenda wapi jameni? Unataka
nini bana?
Tunawaambiaje? Tunauliza swali tu moja. Why is HIV not included to SHA?
Nataka kuchukua hiyo picha ya SHA.
Tunauliza swali tu moja. Why is HIV not included to SHA? Wanatuambia nini? Watuambie ni nini? Ni nini HIV? Ni nini HIV na umanga hivi? Ni nini?
Today, we people living with HIV and at risk and affected by HIV and related co-infections, including tuberculosis and related comorbidities, have noticed the deteriorating quality of HIV services in the first few months. We do hereby issue this letter to NASCOP calling for the sustained improvement of quality of HIV care, even in the face of integrated people-centered health services. We take this opportunity to raise up the important issues below for the NASCOP to follow up and action. One is quality of care. People living with HIV deserve the quality of HIV care as outlined in the guidelines on minimum package of care, including quality laboratory services, not just the issuance of ARVs. Two, the user fee. People living with HIV need clarity. If it is the official policy of Kenya government to charge people living with HIV when seeking care, if so, can there be a waiver for the most vulnerable recipients of care? Three, integration. We as people living with HIV demand that you train and sensitize healthcare workers, including CHPs, on privacy and confidentiality and on screening for HIV co-infection and morbidity, including other non-communicable diseases. E.g., we want people living with HIV to be taken up as mentor mothers, adherence counselors, peer educators, laboratory and diagnostic services that include HIV testing kits and reagents, viral load, especially now that we are going through problems with PPT tubes. You've just brought a few to the facilities. CD4 count machines. For TB, partner with the National TB Program to make sure molecular technology, that is gene experts, and the loop-mediated isomethyl amplifiers make lab tests and diagnostics free for people living with HIV as part of care. Creating liver function and drug-resistant testing. Those are some of the things that we don't get and we are demanding to have because of the side effects of the drugs. Secondly, we urgently ask that you provide documentation on the numbers of people living with HIV who need the minimum package of care for consideration to the Social Health Authority cover. The documentation should be shared with Nephak so that we can follow up and advocate.
Unataka tukupe, unataka tukikuja pale hospitali tupange line. Mbona tunaenda integration? Mbona wajafanya training pale daktari wako under nini government waambie hivi ndio unaweza manage.
NSDCC urgently coordinate national people living with HIV leadership summit to deliberate on HIV financing and community engagement in the response to HIV, to synthesize the HIV community on the changing HIV response landscape. We also take this opportunity to raise up the important consideration below. Strengthen coordination and clarifying on the implementation work the NSDC is doing, where implementation of activities is concerned. Make sure the NSDCC foster partnership with peer HIV network. Work with peer HIV through their networks in the work you do. Ensure coordinated, structured and meaningful engagement and not engagement based on preference. Only communicate valid and accurate data that reflect the reality of HIV/AIDS in Kenya. If you work with peer HIV community, you'll be able to know when services, churches, laboratories are not working, so that you do not give statistics that are inaccurate. For example, we have come across data